Hello, this is Dr. Stanley Lang. Welcome to this video, and the discussion is on the topic of how to decrease risk of serious infection with the current COVID virus. And I wanted to mention these ideas because of the fact that a lot of people are kind of going stir crazy being stuck at home. And there's basically a couple of different options that people have that I want to highlight. First is to see this as an opportunity to actually try to get healthier. A lot of people have a common excuse that they don't have time to build or do a wellness program because they're too busy with life. And so the different things that are part of getting well and getting into good health, including taking the time to eat well, to eat healthy, taking the time to get the exercise you need. A lot of times people just feel this incredible inertia against being able to do these things because they're busy with life. Well, right now, most people are not so busy with life. And I wanted to encourage anybody that's watching this video to think about the opportunity to really focus on building some good, healthy habits. And that in particular means eating low glycemic. Now, why would that be good in terms of decreasing risk of infection? Well, as I've mentioned in other videos and a lot of other people have mentioned, the major risk factors for serious infections with COVID, besides age and besides the obvious of lung disease, are coronary artery disease, hypertension, diabetes, and obesity. And all of these last four things have one major thing in common, and that is severe insulin resistance. Now, insulin resistance happens by eating the standard American diet. So if you follow the standard American diet, you're going to develop insulin resistance almost certainly. And the question is only how bad is it going to get? So by reversing the standard strategy of eating, by eating low glycemic all of the time, you can reverse a lot of the chemistry, the bad chemistry of severe insulin resistance within a few weeks. Within a couple of weeks, you can measure major changes already going on. Now, I suspect that this equals decreased risk if one gets the infection. Nobody's done the research to show that. All we know is that there's a correlation of increased risk if you've got these conditions. So it stands to reason if you reverse the condition, you decrease your risk. So this is really an opportunity to do two things. Number one, finally establish some health patterns that can serve you well for the rest of your life by starting to develop the habit of eating low glycemic, which will definitely guarantee significant and usually very rapid weight loss. The second, of course, doing modest exercise. And that not only deals with whatever health problems you've got right now, it decreases risk probably of a serious response to getting a COVID infection. Now, the alternative to this first alternative, which is to use this time as an opportunity to get healthy, is to basically not do that and do the opposite, which a lot of people are doing. They're basically ordering food in on a regular basis, and this is basically food that's going to worsen your insulin resistance problem if you've already got it. And I don't want to say anything to hurt the food in the restaurant industry because I know they're hurting badly, but for you personally to be relying on food that's been cooked for you, it's guaranteed that if that's happening very regularly, you're shooting yourself in the foot when it comes to this insulin resistance. And so it's a challenge to decide to use this time to really build your health, build health habits, but I believe it's well worth it. And as I said, I do think it's likely that it also decreases your risk if you have the unfortunate thing happen of getting this infection. So I encourage you to take advantage of the time to really build good health habits. Within a few weeks, you can start to see the difference, you can feel the difference within a week, see the difference within a couple of weeks, And you can measure the difference within a couple of weeks if you're measuring particular blood tests. So I encourage you to choose health, and I wish you well. God bless, and have a good day.